We participate in the Trauma Quality Improvement Program, which is a national benchmarking program that compares us to similar trauma centers across the country. In the fall of 2016, we received a report that showed that we were about in the 80th percentile for ventilator-associated pneumonia in adult trauma patients.
Maybe they were going to work and got hit by a car. Healthy people, and something like a pneumonia can really impact you and even cause death. And they expect for us to save their life, and that's what we want to do, and that's what we try our best to do.
Our rate was about 3.5% of every adult trauma patient developed a ventilator-associated pneumonia, meaning that the patient was mechanically ventilated at the time that they developed the pneumonia, which we felt there was an opportunity for improvement for lowering that number. So we all sat down with the trauma program, myself, Sally Jacko, the trauma program manager, and our trauma medical director to discuss what we could do as a group. There wasn't a culture of empowerment of the nurses at the bedside to be able to reduce the amount of sedation, which allows the patients to be extubated or to have the breathing tube removed earlier. We also felt that there wasn't a culture of monitoring that oral care was being done properly, which is an important step in infection control. So we wanted to think of a process to streamline these basic maneuvers and make them part of standard practice. So we developed basically a very simple pen and paper checklist with 4 major criteria that we wanted to be done every day on every single ventilated patient. After about 1 month, we had increased our compliance to 100%, and then we sustained it for the rest of the 6-month period.
We were all willing. And once you have that willingness, you can get anything done. Teamwork.
Further continued to see that change in the fall of 2018. Our rate was down to 0.5% for a decrease of 3% overall. I think that the simplicity of the project is really what made it so successful. We were just ensuring that people were getting real-time feedback, and the players who actually make the difference, the bedside nurses, the ICU physicians, the respiratory therapists, that they were involved in the decision-making, and having that buy-in really allowed for everyone to come together and make these relatively simple changes and really make a difference in patient care and patient outcomes.